Healthcare Access Program at Nebraska Appleseed, and we're excited that you're here with us today to talk about Medicaid expansion. I've got two other people with me today, Gina Ragland and Johnny Lopez. I'll let them introduce themselves. Gina, if you want to start.
Thanks, Molly. My name is Gina Ragland. I am the Associate State Director of Advocacy with AARP Nebraska.
And Johnny.
Hi, everyone. I'm Johnny. I'm with HRS for Race, and I'm a certified federal navigator.
Awesome. So Medicaid expansion is something that we've been talking a lot about across the state for several years now, but finally this year, people are able to sign up and get covered through the program. This program started coverage on October 1st of this year, and it covers adults between the ages of 19 and 64, up to 138% of the federal poverty level. What that looks like in real world dollars is about $17,000 for an individual and $29,000 for a household of three. Medicaid expansion really steps in to fill in the gaps in our insurance system. It primarily will cover adults who don't have children, who can't get covered in other ways under our traditional Medicaid program. And it will also help cover parents who make too much for traditional Medicaid, but not enough to get help purchasing coverage on the ACA marketplace. We know that about 90,000 Nebraskans are eligible for this program, and that number is before COVID. So we're likely have several thousand more people who are eligible beyond that 90,000 due to folks losing insurance in the pandemic. A little over 14,000 people have signed up as of last week. So that's really exciting that people are finally able to get coverage. And this year has really reminded us how important it is to have coverage, both from a health perspective and folks knowing that if they need services at a healthcare provider, whether that's preventive care and just getting a checkup, or if they have a health issue that they need to treat, that they're able to do that. But it's also really important financially for families to have that security that if something does happen, they're able to have insurance to protect their finances. The way the Medicaid expansion program is working is that there are two different benefits packages, two different tiers that people are able to get depending on their personal characteristics. Most people will receive a basic benefits package that does not include dental, vision, or over-the-counter drugs, but includes all the other Medicaid benefits. So physical health things like hospitalizations or doctor's visits, things like that. For folks who are ages 19 and 20, who are pregnant, or who receive a designation of being medically frail, which essentially means having a chronic health condition, they can receive a prime benefits package that includes dental, vision, and over-the-counter drugs. So depending on your situation, if you apply, you may be in one of those two different benefits packages. Either way, it's great that people are finally able to get signed up for this coverage this year. And we'll have Gina talk a little bit about why it's so important that people get covered from AARP's perspective.
Thank you, Molly. And again, thank you for hosting this today and for everyone that's watching. AARP Nebraska is one of the many groups that has worked tirelessly for several years to close the healthcare coverage gap for, as you said, Molly, the nearly 90,000 low-income Nebraska adults, which in our perspective also includes the 19,000 Nebraskans between the ages of 45 and 64 who are uninsured and have those incomes that are below 138% of the poverty level. Although the primary population that we work for or advocate for are persons 50 and older, we continue to recognize that not only persons in the 50 to 64 age group will qualify for the expansion program, but this would also affect those 50 and older that care deeply about and often are the caregivers for their children, their grandchildren, younger family members, friends, and even their neighbors. Medicaid expansion meets the needs of those younger family members, friends, and neighbors. And over again, we have heard the words that person is the coverage gap or that person in the coverage gap is me, my son, my daughter, my grandchild, my hairdresser, or even their neighbor who shovels their walks. Medicaid expansion is crucial to all populations, and in particular, persons 50 and over in their pre-Medicare years are all too often finding themselves without insurance. Many have lost their jobs through no fault of their own, through layoffs, corporate restructuring, inability to cope with the physical demands of the jobs. We've also seen the recent effects of the pandemic playing a big part in this as well. They may find it necessary to leave their job to care for a loved one, such as an elderly parent, a sick child, a grandchild, or even to care for a child during the pandemic. The other thing is age discrimination in jobs is still an unfortunate fact. So finding a new job with health insurance or a decent salary may be difficult or impossible to do. A growing body of research continues to show that Medicaid expansion is yielding significant benefits for those gaining coverage, their families, and even their communities. And specifically, some of the research I want to mention briefly here was done by the Center for Budget and Policy Priorities. And it shows that Medicaid expansion leads to increased health coverage, better access to health care, better health outcomes, including fewer premature deaths, more financial security, and opportunities for economic mobility, lower uncompensated care costs, and of course, the strong response that we need to have now with COVID-19. So it's just some examples of that. And again, this research was done in the states that have expanded Medicaid that again really reiterates why this is such an important program. Again, one of those is improved access to care. And there are more low-income adults with a personal health care provider that are now getting checkups and other preventative care, and again, in addition to getting the regular care for those chronic conditions that they might have. That improved health outcomes, fewer premature deaths are among older adults now. There's improvements in overall self-reported health, reductions in their share of low-income adults screening positive for depression, and then of course improved diabetes and hypertension control. Also, there's early stage cancer diagnosis that are increasing. And then the other important part, I think, too, is the decreases in the share of patients receiving surgical care that's inconsistent with the medical guidelines. Financial security is also another factor that comes into play here. There have been reductions in the share of low-income adults struggling to pay their medical bills, as well as reductions in evictions among low-income renters. Again, I think we've been seeing a lot of that maybe change again with the COVID, but as we see Medicaid expansion here in Nebraska, hopefully that will help counteract some of that as well. And then the last thing I would just mention is the increased economic mobility. There's been a better access to credit. One of those figures including lowering interest mortgages, auto and loan rates with annual interest savings that have amounted to about $280 per adult by gaining that coverage. Of course, the last then is reductions in uncompensated care. And the research is now showing there's been a 55% drop in hospital uncompensated care costs. And of course, that is an improvement in hospital budgets, especially for our rural hospitals who often are struggling more than anything. Healthcare is a basic human right, and ARP supports the Adult Heritage Health Program because it provides coverage for hardworking Nebraskans. Those that work in restaurants, those that are caring for our elders, disabled, and children, those that might be working in our factories, assisting in our schools, cleaning our buildings, stocking our grocery shelves, cutting our hair, running the cash register at the checkouts, counters, and so on. And again, all of these positions are not age specific. So again, it's a gamut of the spectrum of age. I think it's important that every Nebraskan know and understand their options for healthcare coverage. While they may not qualify for the benefit, they may know of someone that might. Maybe again, it's their daughter, son, their grandchild, their next door neighbor, a friend or a friend of a friend, and so forth. And really our goal here is education and making sure that all Nebraskans, regardless of their age or situation, know about the benefit. ARP is proud and excited for the long-awaited arrival of the new Heritage Health Adult Program, and we appreciate the work so many have done for advocating for the benefit for this program. And lastly, we just appreciate, again, the work that Nebraska Appleseed has done in advocating, getting it on the ballot, passing it on the ballot, and now advocating to get the benefit the program moving forward. So again, we thank you for the opportunity today, Molly, and that's what I had.
Awesome. Thank you, Gina. I think you lifted up a lot of really important information about how this program could both directly impact Nebraska's seniors and folks that are, experiencing not being able to have insurance for a number of different circumstances, but also the downstream impacts that it can have on communities, both the health of our community and then the financial well-being. So thank you for lifting up all that really important information. Next, we'll go to Johnny. He will explain a little bit about what he does to help folks sign up for coverage and different ways that you can get help in seeking out this new program.
Hello, everyone. My name is Johnny Lopez, and I work for HRS Erase here in Nebraska. Thank you very much, Molly, for having me here today. So yes, what we do mainly is we help everyone and anyone that needs help signing up for expanded Medicaid or any kind of healthcare through the marketplace. We're there to make it easier for them to sign up, to answer any questions they might have throughout the process of signing up. With expanded Medicaid, as Gina also mentioned, I did open up the doors for many populations, many different age groups. Now you're able to get expanded Medicaid for anybody from the ages of 19 to 64, and we're just there to help them with any language help barrier they might have. We do have a language line that we also go through that helps anyone that needs help in English, Chinese, Spanish, any language. And since we do have really high population here about the Karen population, we're here to help them too. We do have a great language line, and we're basically just there to make sure that they understand the language, understand what they're signing up for, and if they have any questions throughout the process, we're also there to make sure that we explain it to them properly. There's also many ways for you to go ahead and sign up. A really great way that you can go ahead and get that help in any place in Nebraska that you live is going to enroll-ne.org. And on there, you're able to get that help that you need by finding who can help you in the area that you live in and get you that local help.
Thank you so much, Johnny. And yeah, just that enroll-ne.org resource that came up at the bottom of the screen is really helpful. There's a map that you can search out local assistance in your area. So folks like Johnny all across the state who can help walk through the process of applying for Medicaid expansion, and also as we get closer to signing up for marketplace coverage, they'll be there as well to help. One question that I have gotten quite a bit in talking about this new program is Gina spoke specifically about folks that are maybe 40 to 64, 45 to 64. We've gotten a lot of questions about the impact on students and students who maybe aren't covered by their parents' insurance or who are working part-time. This is a program that definitely would be something students could be eligible for, or folks that are just sort of starting out their career who don't have other insurance options and are within the income guidelines. So I did just want to lift that up as well. We are also at Nebraska Appleseed, we have a designated Medicaid expansion webpage for folks who want additional information. We're updating that as more information comes out, and that is neappleseed.org/Medicaid expansion. You're also free to contact our community assistance line for more information as well. And that is at neappleseed.org/gethelp, or on the phone number that is at the bottom of the screen, 483-8853, extension 205. We're also always interested in hearing from people about their personal stories with this program and why it's important to them, and lifting those up so that we can encourage even more people to sign up. As Gina was mentioning, it's often the case that people hear about this program, they themselves may not be eligible, but they may know someone, whether that's a family member or a friend or someone that they know in their community that could benefit from it. So we're really just trying to get the word out as much as possible. So we're always looking for folks who are interested in sharing why this is a program that they care about, why it's important. If you want to get involved with healthcare through Nebraska Appleseed, you can text all caps my voice, MYVOICE, to 52886, and that will get you into our list for different opportunities to get involved and share your story. With that, I don't believe we have any questions. I don't know, Gina or Johnny, if there are things that you feel like you want to add or share, or if there are questions that you've gotten before from folks in the community that would be helpful to share here.
The only comment I guess I would make, Molly, is reiterating to people, even if you're in doubt or you have any doubts that maybe you won't qualify, we just really encourage people to still go through the process and do the application process and then get that final determination, because you just never know. And there's nothing worse than someone that's struggling that maybe could qualify for coverage that maybe didn't quite understand what all was entitled, or what all went into the application process. So and it's so lovely having navigators that can help with that process. So I think my message is, if you're in doubt, make sure that you do it anyway. It's better to get the final results when you know what it really is, versus if you're just assuming. So if in doubt, fill out the application.
Yeah,
Yes.
that's a great message. Oh, go ahead, Johnny.
Oh, sorry, I was just going to mention that yes, a lot of people think that n- normally, yes, it is only open for individuals that were deemed by the SSI that they had a disability, or that you were you were pregnant and having a child. But with expanded Medicaid, it does open up that door for anyone making that 138% of the poverty level. But yeah, just know people that, like Gina also said and you mentioned, just go out there, get that information, get that help that you need to find out if you do qualify, because you might, especially now with the pandemic and so many people losing their jobs in healthcare because of job loss. You might be eligible for it now and weren't before. So yeah, just go ahead and get that help. Sign up.
Yeah, that's a great point, Johnny. We've heard from a lot of folks who maybe applied for Medicaid a couple years ago and weren't eligible, or thought that were told they weren't eligible before, but with this program just starting, like, you could very well be eligible now. Or if you haven't had an income change, it's possible too that you could be eligible now too. So really, all you're out is the time of doing the application. So yeah, I think that's a really important message to, if you think you're eligible, you should definitely try to sign up. Um, Anything else from Gina or Johnny to lift up? I would just reiterate again that we have resources available on our website. We're getting quite a few different questions about the different benefits packages that folks could receive, and we'll be putting out some information on that that is in writing that I think it will be helpful. But please seek out those resources on our website, or reach out to our community assistance line if you have additional questions. With that, I would just thank Lincoln TV for the time today and for allowing us to get this message out that's so important for our community, and for both those that can sign up for this program and get the benefit of having coverage, but then also our community at large is benefited when we all have health coverage. So thanks again.
Thank you for having me.